I am Dr. Hina Kim, men's health and wellness specialist. As the body moves beyond 50, it continues to adapt through natural and gradual changes in energy, strength, and recovery patterns. With steady daily habits, many of these changes can be better understood and supported in a balanced way. The focus remains on consistency, awareness, and long-term well-being rather than short-term adjustments. Backhand index pointing right: why your body changes after 50. I am Dr. Hina Kim, men's health and wellness specialist. In this consultation-style explanation, I want to help you understand what commonly happens in the male body after the age of 50. This is not about fear or concern. This is about awareness, balance, and making informed lifestyle choices. When men reach their 50s, the body naturally goes through gradual biological changes. These changes are usually slow and normal, and they are influenced by aging, hormones, activity levels, sleep patterns, and long-term lifestyle habits. One of the most common changes is a reduction in muscle mass. As we age, the body becomes less efficient at maintaining muscle tissue if physical activity is reduced. This can lead to decreased strength, slower recovery after exercise, and a feeling of lower physical energy during the day. Regular movement and light resistance exercise can help support muscle maintenance, but it is important to approach this gradually and safely. Another common change is a shift in metabolism. Many men notice that their body does not burn calories at the same rate as it did in their 20s or 30s. This is a normal metabolic adjustment associated with aging. As a result, weight management may require more attention to food choices and portion sizes. Balanced nutrition becomes more important than restrictive dieting. A diet that includes lean protein, vegetables, whole grains, and healthy fats can support overall energy and metabolic balance. Hormonal changes also play a role during this stage of life. Testosterone levels in men can gradually decline over time. This is a natural biological process and does not happen the same way for everyone. Some men may notice changes in energy levels, mood stability, or physical endurance. However, these changes vary widely and should always be understood in a broader health context rather than as a single cause. Sleep quality is another important factor after 50. Many men report lighter sleep or more frequent waking during the night. Sleep is closely connected to energy, cognitive function, and metabolic health. So maintaining consistent sleep habits becomes very important. Simple routines such as a fixed sleep schedule, reducing late-night screen exposure, and avoiding heavy meals before bedtime can support better sleep quality over time. Cardiovascular health also deserves attention in this age group. As the body ages, blood vessels may gradually become less flexible, and blood pressure patterns may change. This does not automatically indicate disease, but it does mean regular checkups are important. A balanced lifestyle that includes walking, light aerobic activity, and stress management can support heart health. Mental and emotional well-being also changes with age. Many men in their 50s experience increased responsibilities, life transitions, or changes in work-life structure. These factors can influence stress levels and overall mental clarity. It is helpful to maintain social connection, engage in meaningful activities, and allow time for mental rest. Stress management is not only about relaxation techniques, but also about maintaining a stable daily rhythm. Digestive changes can also occur. The digestive system may become slightly slower with age, and some foods may feel heavier than before. Hydration, fiber intake, and regular meal timing can support digestive comfort. Listening to the body's signals becomes more important than following strict or extreme dietary patterns. Now, I want to emphasize something important. These changes are not sudden failures of the body. They are gradual adaptations that occur as part of the natural aging process. The goal is not to reverse aging, but to support the body in functioning well at every stage of life. From a medical perspective, the most effective approach at this age is consistency. Small, sustainable habits often have more long-term value than intense short-term efforts. This includes regular physical activity at a comfortable intensity, balanced nutrition without extreme restrictions, adequate hydration throughout the day, consistent sleep patterns, routine medical checkups. Each of these areas works together to support overall well-being. It is also important to understand that individual experiences vary. Two men of the same age may have completely different energy levels, strength, and health markers depending on genetics, lifestyle history, and daily habits. So comparison with others is not always helpful. Personal awareness and steady self-care are more meaningful. If you notice changes in energy, strength, sleep, or mood, it is generally useful to observe patterns over time rather than focusing on short-term fluctuations. The body communicates through gradual signals, and those signals are best understood in context. In clinical practice, I often encourage men in their 50s to focus on maintenance rather than intensity. This means supporting what already works in the body instead of pushing it beyond sustainable limits. It is a balanced approach that prioritizes long-term health stability. As we continue this discussion, I will also explain how lifestyle adjustments can be tailored more specifically to support energy, mobility, and overall daily functioning in this stage of life. In clinical perspective, one of the most practical areas to focus on after 50 is daily movement quality rather than intensity alone. This includes maintaining a combination of light aerobic activity, basic strength work, and mobility exercises. Walking on a regular basis is often a safe starting point for many men in this age group. It supports circulation, joint mobility, and general endurance without placing excessive stress on the body. Alongside this, light resistance-based activity can help support muscle maintenance. This does not require advanced training routines. Even simple bodyweight movements performed consistently can contribute to functional strength. Flexibility and joint mobility work are also important. As the body ages, stiffness in joints may become more noticeable, especially after periods of inactivity. Gentle stretching and controlled movement can help maintain comfort in daily activities. From a nutritional standpoint, balance becomes more important than restriction. Protein intake is often emphasized in this stage of life to support muscle maintenance. This should be paired with adequate fiber intake from vegetables, fruits, and whole grains to support digestive and metabolic function. Healthy fats, such as those found in nuts, seeds, and certain oils, can also contribute to overall nutritional balance when used appropriately. Hydration is another key factor that is sometimes overlooked. Water intake supports energy regulation, digestion, and general physiological function. Even mild dehydration can affect how the body feels throughout the day. It is also useful to consider how meal timing affects energy patterns. Some individuals may notice improved comfort when meals are spaced consistently throughout the day. This is less about strict rules and more about observing how the body responds to routine. Reducing highly processed foods and excessive added sugars can also help maintain steadier energy levels. Another important area is stress regulation. Chronic stress can influence sleep quality, appetite patterns, and perceived energy levels. Simple daily practices such as structured breathing, short breaks during the day, or quiet time without stimulation can support nervous system balance. These approaches are not treatments, but they are supportive lifestyle tools that many men find helpful when used consistently. Preventive health monitoring also becomes more relevant after 50. Regular checkups can help track blood pressure, cholesterol levels, blood sugar patterns, and general metabolic markers. These assessments are not about predicting outcomes, but about understanding current health status and making informed lifestyle decisions. Early awareness allows for more stable long-term management of overall health. It is also important to recognize the role of consistency in all of these areas. Occasional effort has limited impact compared to steady, long-term habits. Even small daily actions, when maintained over time, can contribute to better physical stability and overall well-being. At this stage of life, the goal is to maintain independence, energy balance, and functional strength in a sustainable way. This requires attention to movement, nutrition, rest, and mental well-being as interconnected systems rather than isolated factors. As we continue exploring this topic, I will further explain how these lifestyle components interact with long-term energy regulation, recovery capacity, and everyday performance in men over 50. From a physiological standpoint, recovery capacity becomes an important concept after 50. The body still responds well to physical activity, but the time needed for recovery after exertion may increase gradually. This is related to changes in cellular repair processes, sleep depth, and overall energy regulation. Because of this, allowing adequate rest between activity sessions becomes more important than increasing intensity. Another key factor is circadian rhythm stability. The body's internal clock influences sleep, hormone patterns, digestion, and daily energy levels. Irregular sleep schedules, late-night screen exposure, and inconsistent meal timing can gradually disrupt this rhythm. Maintaining a consistent wake-up time and sleep window can help support more stable daily energy patterns over time. Low-grade inflammation is another area that is often discussed in aging physiology. This is not a disease condition in itself, but a general biological state that can be influenced by lifestyle factors. Diet quality, physical activity, sleep consistency, and stress levels all play a role in how the body regulates inflammatory responses. A balanced lifestyle pattern tends to support a more stable internal environment. Gut health also becomes increasingly relevant in this age group. Digestive efficiency and microbiome balance can influence nutrient absorption, energy levels, and overall comfort. A diet that includes fiber-rich foods and fermented options may support digestive diversity. However, changes should be gradual and individualized based on tolerance. Cognitive function is another important component of wellness after 50. Many men may notice changes in focus speed or memory recall under stress or fatigue. These changes are often influenced by sleep quality, hydration status, and mental workload rather than a single factor. Engaging in mentally stimulating activities and maintaining structured daily routines can support cognitive clarity. Postural stability and balance are also important considerations. With aging, muscle coordination and joint awareness can gradually change. This may affect posture during long sitting periods or balance during movement transitions. Simple balance-focused exercises and posture awareness during daily activities can contribute to better physical control. It is also important to evaluate medication use and general health monitoring as part of overall wellness. Many individuals in this age group may be managing one or more health parameters under medical supervision. Understanding how medications interact with lifestyle habits such as diet, hydration, and sleep is important for maintaining stability. Regular review with healthcare professionals ensures that management plans remain appropriate over time. Energy variability throughout the day is another common observation. Rather than expecting constant energy levels, it is more realistic to understand natural fluctuations. Planning demanding tasks during higher energy periods and allowing lighter activity during lower energy periods can improve daily function efficiency. Physical adaptation at this stage should remain gradual. Rapid changes in activity levels or extreme dietary shifts are often not necessary and may be difficult to sustain. A structured but flexible approach tends to produce more consistent long-term results. As we continue this discussion, the next step is to understand how these interconnected systems, metabolism, movement, sleep, and stress response, collectively influence long-term functional health patterns in men over 50. From an integrated medical perspective, it is useful to view the body after 50 as a coordinated system rather than separate functions. Metabolism, sleep regulation, hormonal balance, and cardiovascular function all interact with each other on a daily basis. When one area becomes inconsistent, it can influence the others gradually over time. For this reason, stability in routine often has more value than focusing on any single isolated factor. A practical approach often used in clinical guidance is the concept of weekly rhythm consistency. This refers to maintaining similar patterns for sleep, meals, and activity across most days of the week. The goal is not strict rigidity, but predictable structure that the body can adapt to efficiently. Even small variations in timing can affect energy stability in sensitive individuals. Another important consideration is physical load distribution. Instead of concentrating activity into 1 or 2 intense days, it is generally more balanced to spread movement across the week. This allows musculoskeletal structures and cardiovascular systems to adapt more steadily. It also reduces the likelihood of fatigue accumulation. Monitoring subjective signals from the body is also an important part of long-term wellness. These signals include sleep quality, morning energy levels, appetite consistency, and recovery time after physical effort. These indicators are often more sensitive than occasional clinical measurements in reflecting day-to-day balance. Noting patterns over time can provide useful insight into lifestyle effectiveness. Hydration timing and consistency can also influence daily physiological stability. Fluid intake supports circulatory function, cognitive performance, and metabolic efficiency. Rather than large intermittent intake, steady distribution across the day is generally more supportive. Environmental factors such as heat exposure or physical activity levels should also be considered. Nutritional timing can also be adjusted based on individual energy patterns. Some individuals function better with a more substantial morning intake, while others prefer a gradual distribution of calories throughout the day. There is no single universal pattern, but consistency in whichever pattern is chosen is often beneficial. The key focus is predictability rather than complexity. In terms of physical recovery, attention to post-activity rest is essential. This includes adequate sleep duration as well as low-intensity recovery periods during the day when needed. Over time, recovery efficiency can be supported by avoiding excessive strain without sufficient rest intervals. This balance becomes increasingly relevant with age-related physiological adaptation. Mental workload management is another component of overall wellness. Cognitive fatigue can accumulate even without physical exertion. Structuring tasks with short breaks and alternating between high-focus and low-focus activities can support mental endurance. This is particularly relevant in individuals who remain professionally active after 50. From a preventive health standpoint, longitudinal tracking is more informative than single-point evaluations. Observing trends in blood pressure, lipid profiles, glucose regulation, and body composition over time provides a clearer picture of health trajectory. This allows for more informed lifestyle adjustments when needed. At this stage, the emphasis remains on maintaining functional independence and physiological balance through steady daily habits. The interaction between physical activity, nutrition, sleep, and stress regulation continues to shape long-term outcomes in a cumulative way. A key physiological concept at this stage of life is metabolic flexibility. This refers to the body's ability to efficiently switch between different energy sources based on activity and dietary intake. With aging, this flexibility may gradually decrease if physical activity becomes limited or dietary patterns become highly irregular. Supporting consistent movement and balanced nutrition can help maintain more stable metabolic responsiveness over time. Another important area is muscle protein synthesis efficiency. As men age, the body may require more consistent dietary protein distribution across the day to support muscle maintenance processes. This does not imply high intake alone, but rather regular and balanced incorporation of protein sources within meals. Combined with resistance-based activity, this supports functional strength and mobility preservation. Bone density regulation also becomes increasingly relevant after 50. Gradual changes in bone remodeling processes are a normal part of aging physiology. Weight-bearing activity, adequate mineral intake, and overall nutritional balance contribute to maintaining skeletal support structures. This is part of long-term mobility preservation rather than short-term change. Insulin sensitivity is another important metabolic factor in this age group. The body's response to glucose may become less efficient over time depending on activity levels and dietary patterns. Regular movement after meals and balanced carbohydrate intake can support more stable glucose regulation patterns. This is a gradual adaptation process influenced strongly by lifestyle consistency. Another frequently observed change involves reduced non-exercise activity thermogenesis. I am Dr. Hina Kim, men's health and wellness specialist. To summarize this discussion, the changes that occur in the body after 50 are generally gradual and related to natural aging processes. These include shifts in metabolism, muscle maintenance, sleep patterns, recovery capacity, and overall energy regulation. From a medical perspective, the focus should remain on steady lifestyle balance rather than extreme adjustments. Consistent movement, balanced nutrition, adequate rest, and routine health monitoring together form a stable foundation for long-term wellness. As always, understanding your body's patterns over time is more useful than reacting to short-term fluctuations.